You're reading something, an article maybe, a text, and your eyes are moving across the words, but your mind is 3 tabs away. Part of you is listening for a notification, another part is rehearsing something you need to say later, and some sliver, the one actually reading, is barely holding on. That feeling of being everywhere and nowhere at once. Researchers now have a name for it. And what they're finding is more troubling than simple distraction. In 2025, a team of researchers published something unusual, not a study about social media addiction or screen time limits, something different. They surveyed mental health professionals about patterns they were seeing, symptoms that didn't quite fit existing categories, attention problems that weren't ADHD, anxiety that wasn't generalized. What they found was striking. 85% of clinicians said they were already recognizing a condition most textbooks don't acknowledge exists. The Diagnostic and Statistical Manual of Mental Disorders, the DSM, is the Bible of psychiatric diagnosis. It was last updated in 2013. Think about that date for a moment. 2013. Before TikTok existed, before the average person was checking their phone 150 times a day. Before notifications became constant, before scrolling became a verb, we used to describe how we spend our evenings. Our diagnostic frameworks were built for a world that no longer exists, and therapists are noticing. The 2025 study in Frontiers in Digital Health surveyed clinicians about something they called continuous partial attention disorder, CPAD. 85.3% recognized it in their patients. This wasn't about checking social media too much. The researchers described it as chronic attentional fragmentation across competing digital streams, not attention deficit. Attention fragmentation, a constant state of partial presence, where you're technically focused but spread across so many streams that none of them fully register. The study didn't stop there. Digital anxiety disorder, anxiety triggered specifically by digital disconnection, was recognized by 82.7% of clinicians. And Doomscrolling disorder, compulsive consumption of negative news content, came in at 78.7%. 3 conditions, none of them in the DSM. And more than 3/4 of mental health professionals say they're seeing them in their practices. Here's what makes this complicated. These conditions don't map neatly onto what we already know. Someone with CPAD might look like they have ADHD, but the mechanism is different. ADHD is a neurodevelopmental condition. You're typically born with it. CPAD appears to be acquired, created by environment, by habit, by the constant pull of competing information streams. The researchers described CPAD as a maladaptive adaptation, your brain doing exactly what it's designed to do, but in an environment it wasn't designed for. And it's not just attention. The study found these conditions compromise emotional regulation and executive functioning, the higher-order thinking that lets you plan, prioritize, and control impulses. Think about what that means in daily life. The person who can't stop checking their phone in the middle of a conversation, the one who feels genuine panic when their battery dies. The worker who reads the same email 4 times because they keep getting pulled away mid-sentence. These aren't character flaws, they're symptoms. The clinical picture is stark. Researchers describe digital overload as involving cognitive strain, attentional instability, memory disruption, and affective dysregulation. In plain language, your thoughts become harder to organize. Your focus becomes unstable. Your memory gets worse, and your emotional responses become harder to regulate. And here's where it gets particularly concerning for parents. Research published in 2025 found that children exposed to screens for more than 2 hours daily show measurably shorter attention spans. Prolonged screen time was linked to reduced sustained attention, the kind of deep focus that lets you finish a book, complete a puzzle, or work through a difficult problem. And it's not just about time on devices, it's about what happens to your brain while you're using them. A meta-analysis in Frontiers in Psychology found that visual distractions in digital settings reduce reading speed and impair text processing efficiency. Online environments elevate cognitive load simply by existing. Every banner ad, every sidebar notification, every hyperlink your brain registers as a potential click, Each one costs mental energy, even if you don't look directly at it. And then there's TikTok. In 2025, neuropsychological research found that habitual TikTok use was associated with attentional impulsivity and lower academic performance, not just distraction during use. Lasting effects on how impulsively attention moves from target to target, even when the app is closed. This isn't about demonizing technology, it's about understanding what we're trading for constant connectivity. The brain is adaptive. It molds itself to the environment it inhabits, and for many of us, that environment now involves thousands of micro-interruptions per day. The researchers put it bluntly, these conditions reflect maladaptive adaptations to technology that compromise emotional regulation, executive functioning, and psychological resilience. Psychological resilience. That's the ability to recover from stress, to bounce back. The researchers are saying our devices might be eroding that too. And here's the real problem, the one that keeps clinicians up at night. There are no structured diagnostic frameworks for any of this, no clinical guidelines. When a patient walks in with CPAD symptoms, their therapist has no standardized assessment, no evidence-based treatment protocol, no insurance billing code. They're improvising, drawing from ADHD treatments, anxiety protocols, addiction frameworks, trying to piece together something that fits. Some might say, wait, aren't these just existing conditions dressed up in new language? Isn't CPAD just ADHD with a different name? The researchers anticipated that objection. Their answer, the mechanisms are fundamentally different. ADHD involves neurodevelopmental differences in how dopamine regulates attention circuits. CPAD is about learned behavior, neural pathways carved by repetition. You weren't born this way. Your environment trained you. And theoretically, it can be untrained. That's both encouraging and daunting. If technology trained your brain into fragmentation, technology habits might train it out. So what does this mean for you? If you've been feeling like your attention isn't what it used to be, that you can't focus the way you remember, you're likely not imagining it. The first step researchers suggest is what they call attention auditing. Not tracking screen time, that's too blunt. But noticing how often you're truly single-tasking versus spreading attention across streams. Consider keeping a simple log for just one day. Every time you notice your attention splitting, mark it. You might be surprised how rarely you're fully present with one thing. Try creating what researchers call single-stream periods. Deliberate windows where you engage with only one information source, one article, one conversation, one task. Research suggests it may help to start small, 15 or 20 minutes, and build from there. Your attentional muscles might need reconditioning, just like any other skill that's atrophied from disuse. For parents, the 2-hour threshold that researchers identified may warrant consideration, not as a rigid rule, but as a point where attention effects become measurable. What strikes me about this research is how validating it is. If you felt like something's wrong with your focus, like you're not as sharp as you used to be, you're responding to real environmental pressure. You're not lazy. You're not broken. You're a human brain doing what brains do, adapting to the environment. The question is whether we like where that adaptation leads. If you're experiencing symptoms that feel like CPAD, chronic difficulty sustaining attention, feeling spread thin across digital streams, emotional volatility tied to connectivity, know that clinicians are becoming aware. You might want to use that language when you talk to a mental health professional. Tell them you've been reading about attention fragmentation from digital overload. Ask if they've seen this pattern. If this topic interests you, consider subscribing. We explore the psychology behind everyday behavior every week, and a like helps others find episodes like this one. There's a larger conversation happening in psychology right now about whether our diagnostic categories are keeping pace with how quickly our environment is changing. The DSM takes years to update. New categories require extensive research, field trials, expert consensus. That process exists for good reason, to prevent overdiagnosis, to ensure treatments are evidence-based. But it also means there's lag. The world changes faster than diagnostic manuals can capture, and people suffer in that gap. That 85% number haunts me. 85% of clinicians recognizing a condition that doesn't officially exist. That's not a fringe observation. That's a signal. And maybe that's the most important takeaway. Your attention isn't just yours. It's shaped by an environment designed to capture it, fragment it, and redirect it, constantly. Every app, every platform, every notification algorithm, they're all competing for the same finite resource, your mind. Understanding that, really understanding it, is the first step toward reclaiming some sovereignty over where your attention goes. The fractured mind isn't inevitable. It's a response, a pattern, that formed in response to pressure, and patterns can be changed. But first, you have to see it clearly, to name what's happening, to recognize that the struggle to focus isn't personal failure, it's a documented phenomenon affecting millions. And if there's one thing psychology teaches us, it's that seeing clearly is where change begins.